So, what is hazard perception in cataract surgery? Well, hazard perception tests are used around the world to test and train learner drivers' ability to react and respond to hazards on the road. And the way they work is they use video footage or sometimes CGI generated scenes of road hazards and require the participant to watch the videos and then respond to these hazards. It's a prerequisite before starting driving, particularly in the UK. Now, in this scene, you'll see that this is a still, but a driver would basically be proceeding along the road, and you'd see this bicycle coming up on the left. You've got another car approaching you on the right, and you need to click and respond to the hazards as you approach it. We wanted to see if we could apply these same principles of being aware of what the hazards are on the road and apply that to cataract surgery. So, what is a hazard? Well, a hazard is any potential source of harm. That's its definition. And what is risk? Well, risk is slightly different. That is the degree of likelihood that harm will occur when exposed to a hazard. Now, let's think about that applied to cataract surgery. What are the hazards? Well, there seems to be different categories of hazards. So you can have preoperative hazards. These are hazards that will present themselves during cataract surgery that can be known about in advance. Some of them more so than others. So what are the patient factors? So there's going to be things to do with the patient that may be hazards and make the cataract surgery more difficult and may lead to harm. Now, positioning. We all know those patients with kyphosis, problems with their neck and positioning, that can lead to difficult surgery and may lead to harm. The patient may be confused and not able to respond when asked to do certain things, such as staying still. Lots of other things that I'm sure you can think of, and those are some examples. Then there are the eye factors. These are the things that are intrinsic to the eye that we know will make cataract surgery more challenging. Pseudoexfoliation, a well-known factor, should be able to be identified preoperatively and will make cataract surgery more difficult due to zonular weakness primarily and other factors as well. White cataracts can be challenging. They may be intumescent, and also it may make visualization of the capsule more challenging due to not having a red reflex. A small pupil, well known to increase the rates of posterior capsular rupture, and will just make visibility when operating more challenging. Then there are things like equipment factors that can pose hazards. So are you operating in an unfamiliar environment with unfamiliar machinery? Faulty phaco machine or other equipment can also pose a hazard to your surgery. Intraoperatively, then there are a whole host of other factors that tend to present themselves actually during the operation. So inadequate visualization is going to be a hazard. Is the view obscured for any reason through corneal scar, through the eye not being in primary, through viscoelastic egressing out of the wound? A loss of red reflex. This may be due to vitreous hemorrhage, or it may be due to the eye not being in primary. Are you out of focus? A definite hazard, and one that particularly more junior surgeons will come up against. Then there are things such as tissue manipulation. Is there iris contact? Iris contact will lead to the pupil often coming down. It may become floppy. It can lead to hyphema. All of these are potential sources of harm and can lead to compounded harm. Zonual strain. Are the maneuvers being performed causing strain on the zonules unnecessarily? Then there is pressure on the wound. If you press on the posterior lip of the wound, that can lead to viscoelastic egressing out of the wound, or simply shallowing the AC, which again can cause harm. Procedural. Now, I term that as deviating from the natural flow of a surgery, and that can cause harm. So, such as following the correct steps in the correct order. Has the viscoelastic actually been inserted before starting your rexus? Forgetting to do that can be an issue. Taking the irrigation probe out before the aspiration probe can be a hazard. And then things such as phaco settings. Are you using the correct phaco settings at the right time? You do not want to be on sculpt when you're trying to take a piece, and you also don't want to be on very high phaco settings when taking the last piece out usually. So these are all potential hazards. This is not an exhaustive list. I'm sure you'll be thinking of your own hazards, but I just wanted to introduce this concept to you for you to start thinking about the different things that can go wrong during surgery and what might be the cause of those. What are the hazardous things that can lead to complications? If we're more aware of these, then we can correct them and react to them before they lead to harm. Now, another concept intrinsic to this is that of situational awareness. Now, during cataract surgery, people may be aware of the concept of tunnel vision. Well, I think there's phaco vision or phaco probe vision, which is basically when the slightly stressed cataract surgeon, things aren't going well, the patient's moving, the view isn't great, your phaco machine maybe isn't behaving quite the way you want it to, you can start to get stressed, blood pressure goes up, heart rate goes up, and you become very focused purely on the tip of your phaco probe. But there may be other things that are going on around about which you need to be aware of. How's the iris behaving? How are the anterior capsule behaving? Is there any signs of zonular weakness? Is the eye out of primary? Are you in focus? All of these things become relevant, and it can be very easy to develop that tunnel vision, that phaco probe vision. So hopefully this situational awareness training and the hazard perception training, which you'll be experiencing with this hazard perception test, will help you to become aware of those things. And that is very important when watching these videos, to try and look at everything that's going on in the screen. I hope that you enjoyed the test and it'll be helpful to you. This isn't to try and make you think that there are perils around every corner, but being more aware of hazards should hopefully give you more confidence to know how to react to them and then be able to avoid harm. Thanks for your attention.